There is already much to be proud of about health and social care services in North, East and West Devon. Staff work hard to provide good care, local people are relatively healthy compared with other parts of the country, and local organisations already work together to meet the needs of local people. However, services are not keeping pace with the changing needs of local people, and it is becoming increasingly difficult to make sure that local people have access to consistently high quality care that is affordable and sustainable. There are a number of reasons for this. People in North, East and West Devon are living longer, with increasingly more complex care needs that require more support from health and social care services. Some people have more health and social care needs than others. 40% of local people use almost 80% of health and social care. There are 280,000 local people, including 13,000 children, living with one or more long-term conditions. Around 150,000 people in North, East and West Devon have a mental illness. Doing nothing is neither affordable nor clinically sustainable. We will be £400 million in the red if nothing changes. Although there have been some local successes in changing the way services are delivered, there are many challenges facing health and social care in North, East and West Devon.
There are health inequalities across North, East and West Devon. A woman living in Plymouth is expected to die more than 3 years earlier than a woman living an hour's drive away in Tiverton.
Less money is spent on health and social care in the most deprived areas. Over 10% less is spent on health care for each person in West Devon compared to North and East Devon, even when age and deprivation is taken into account.
Care needs to be more person-centred and coordinated, especially for people with more than one long-term condition. People do not get enough support to be independent and are going into hospital when this could be prevented. This is particularly important for end-of-life care, where most people would prefer to die at home, but only a quarter are able to do so.
This is also true for children. Children with a mental illness in North, East and West Devon currently have to wait 8 months to see a child's mental health specialist. Many end up in hospital while they wait for their appointment.
Around 95,000 people with a long-term condition also have a mental illness. These people consume a large proportion of the health and social care budget, but still achieve poor outcomes. They're also more likely to die earlier in life compared to people without a mental illness.
There are too many people in hospital beds who don't need to be there. The longer people stay in hospital, the more likely they are to get complications. It is also expensive to keep someone in hospital when they don't need to be there. The main reasons for delay are people waiting for health or social care in the community.
Local hospitals are finding it difficult to deliver services for some of the most seriously ill people. These include stroke, maternity, A&E and children's services.
Services could be run more efficiently across North, East and West Devon. An estimated £85 million is being spent on areas where staff may be able to provide the same quality of service but more efficiently. 5 to 10% of staff cost was spent on temporary or agency staff in hospitals in 2014 to 15. They are more expensive than permanent staff and can reduce the quality of care and lead to a poor patient experience. Up to £25 million could be saved on clinical supplies if hospitals work together to buy them. A third of bed space in community hospitals is empty or underused. This space could be used for something else, such as other services or community spaces.
There are difficulties with recruiting and retaining staff at all levels, making it hard to provide comprehensive and high-quality services. Many staff are due to retire in the next 10 years, and local organisations already have high levels of vacancies and staff turnover in many areas.
People in North, East and West Devon deserve health and social care services that are of the highest quality and are delivered as locally as possible. Local people should be supported to take responsibility for their own health as much as possible. If people do become ill, they should sit at the heart of a proactive, person-centred care system. Achieving this kind of transformation with the funding that is available is not an easy task. But by working together, the NHS and social services with other public, private and voluntary sector providers of care can get the best possible outcomes for local people.